You know, it was basically a walking heart attack. I had to change, sort of my choices.
And a local man's life-altering weight loss journey with a popular drug. But are these medications the solution or a dangerous trend? I take a closer look at the risks that could impact you. Well, chances are you or someone you know are taking one of the popular weight loss drugs we're hearing so much about. But how much do you really know about them? I've been looking into this trend, and it's impacting people right here in our community. I spoke with a Las Vegas man who says medication was his only option to get healthy. I'm also reviewing the risks and what you need to know before starting any weight loss medication.
You know, it was basically a walking heart attack.
Meet Damian Chambers, a Las Vegas resident who tells me he struggled with weight loss for years.
When I do my weigh-in, I don't eat. As someone who's 5'7", my BMI was very high, and I weighed in at about 218 pounds.
Damian says his weight loss journey has been a personal roller coaster with lots of ups and downs, struggling with high cholesterol and a family history of heart disease. He says even with diet and exercise, it wasn't enough.
My weight had spiraled out of control,
leading him to his last resort, weight loss medication. So from July 19th to August 30th, you went from 204 to 181 pounds. Wow. Damian losing 23 pounds since he started his medication back in mid-July. His weight loss journey is reflective of a larger trend. But now, the medications made for those under medical supervision are now being sold online without a prescription and sometimes without proper oversight.
If you're not a medical professional, I don't know, could it be dangerous? Probably.
Take some nice deep breaths for me.
Damian goes to Dr. Raj Singh's office to get his medication. Dr. Singh says Damian is not alone. In the last 2 years, he tells me he's seeing an overwhelming surge in patients seeking these drugs.
We get like 10-15 calls or inquiries every single day.
What's the biggest concern when it comes to these weight loss medications?
So I think the biggest one is like how easily they are available without a proper blood work or a proper exam.
If you're thinking about taking these weight loss drugs, Dr. Singh says it is critical to check your heart, kidney, and liver function before starting these medications. He's concerned, though. He tells me patients are buying these drugs online and can end up with fake pills or wrong dosages.
There's a huge risk of, developing gallstones if you're losing weight too rapidly. So we have medications we use prophylactically so you don't develop, gallstones.
Blood clots can also be a side effect. Dr. Singh says doctors can help prevent them. Is it better to have that extra medical background to help assist you during it all?
100%, I think it is. I mean, I've gone into this blindly. I did a little bit of research and in consultation, with the doctors here.
Body fat percentages looks great.
Damian's story may sound like yours, and while weight loss drugs can make a huge difference along with diet and exercise, they also come with risks you shouldn't overlook.
For anyone coming into this, it's not like you can just take an injection and lose the weight. That is a very small part of this whole process. I have worked very, very hard. Dr. Singh also tells me that if insurance doesn't cover the cost of medications, you could be looking at out-of-pocket costs ranging from $200 to $500 a month. He also says if you are considering these treatments, make sure to talk to your doctor first.